guys, welcome to my channel. I'm Srishty, a first year MBBS student at Srishty, and in this video I will share the curriculum of MBBS, which is a very complex. This video is the part 2 or a segment from my previous video in which I shared my experiences and what you can expect from the first year of MBBS or the first few months of your college. So if you haven't watched that, please go and watch that first and come back to this video. So let's begin. Medical colleges follow the guidelines issued by NMC, so it would be same in every college. There will be a little bit of difference according to how your college wants to conduct that, but more or less it would be same. So you have 3 major subjects, that is anatomy, biochemistry and physiology. Anatomy means the science where you will study the structure of the body, about the bones, about the different muscles, how these things are organized within the body. Dissection classes will be conducted, bone demonstration will be conducted, lectures will be given about the tissues, how many layers are there in the skin. All these things is what you will study in anat. Now physiology means how the body functions, the functioning of the body. It will deal with how the hormones are secreted and how these hormones act at places, how the food is digested in your body, how your temperature is regulated, how you get fever, how you grow. These how portions are what is dealt in physiology. Now biochemistry, as the name suggests, deals with the chemistry and the chemical structure that is going within the body. For example, urea is formed in your body. So what is the structure of urea? Urea cycle, how it is formed, and the clinical aspects of it if the cycle gets disturbed. Let me just connect these 3 subjects for you. As I told you will study about urea, the structure of urea and the urea cycle in biochemistry. So this urea is formed in liver. So in anatomy, you will study about the liver. How many lobes does the liver have? Where is gallbladder situated? Which is the duct of gallbladder? All these things. In physiology, you will study how bile is formed, how it helps in the digestion of fat, and how this bile is secreted, completing the cycle again. So all these 3 subjects are very closely related, and this will form the basis of the science that you are going to study. The first year is the preclinical year. That means you won't be visiting any clinics, you won't be seeing patients. You will be studying by the books, the lectures, animation, or the cadaver. Now let's delve into the actual curriculum that your college is going to follow. Anatomy has been further divided into subgroups. First, talk about the gross anatomy. In gross anatomy, you will have your dissection classes done in groups, and each group having a cadaver. And usually there are no lectures which are conducted for gross anatomy. Then you will have your bone demonstration classes where you will be taught about each and every bone of human body. And again, these classes are also conducted in small groups. The next subgroup is histology. Here you will have lecture classes and practical period where you will be seeing these different tissues in a microscopic view. And the last, you will have embryology. Here again you will get these lecture classes. Okay, so whenever I say it's a lecture class, it means all the students in your class, which may range from 100 to 200, will be taught at once in one lecture theatre. And in the same way, the exams are also conducted. In the practical exam of anatomy, you will have to identify the different tissues which comes under histology. Second, you will have to identify the bones and whatever is taught in the bone demonstration classes. And third will be the soft tissues, where you will have to identify the different parts that you have dealt with in the dissection classes. And then you will have your written exams, where question will be from throughout the subject. Next, in physiology, you will have lecture classes and practicals. All these finger pricking practicals, these blood experiments that you have seen will be dealt here, and the general and the specific examination of the whole body and different systems will also be dealt. Same way, you will have your practical exams where you will have to perform the given practical, and in the written exam, the whole subject itself. In biochemistry, it's again the same, lecture classes and practicals, and whole exam also the same. In all these subjects, you will also have viva along with the practical exams are generally conducted. Apart from these lecture classes and practical periods, you will also have a few different periods. First is tutorials, which is normal teaching only but done in a smaller group. So this is nothing but a small group teaching kind of a thing. Second is SDL. SDL stands for self-disciplined learning. It is again like a lecture class only, but here the emphasis will be more on the self-study. Okay, so how it is conducted in my college is that our teacher gives us a topic. जैसे आज SDL की class है, तो हमें उसके पहले हमें टॉपिक बताते हैं कि दिस इज द टॉपिक। तो हमें जो रूटीन मिलता है वीकली, उसमें टॉपिक लिखा होता है कि इस एसएसएल क्लास का ये टॉपिक है। वी हैव टू प्रिपेयर द टॉपिक आवरसेल्व्स एंड इन द क्लास the teacher asks us questions and explain the things to us. So this is how the self-directed learning is conducted in my college. It may be different in your college, but as the name suggests, it should depend more on self-study. Third is HCOM. Now HCOM stands for Attitude, Ethics and Communication. These things are a major part of a medical professional, and this is what you will be taught in these classes about how you should talk, how you should behave, about the doctor-patient relationship. And the last is ECE class. This stands for Early Clinical Exposure. Now, as I told you earlier, that it is a pre-clinical year. You are not visiting the clinic. So in these classes, you will be given that clinical exposure. You will be taught about different clinical cases and how you should be dealing with it. Okay, how it is done in my college is that we are given a case. Okay, कि ऐसा केस है, this is the case of 45-year-old man or something. Anatomy का इसी क्लास है, तो हमें उसका एनाटॉमी एस्पेक्ट देखना, बायोकेमिस्ट्री का, तो उसके हिसाब से these classes, as I told you, HCOM, EC are specific for each subject. तो कभी HCOM physiology का होगा, कभी so that's basically it. I have none of this information. So when I got to college, I was perplexed. Okay, what is happening? What is this EC? What is this HCOM? That's why I made this video, so that you have some insight of what is going to follow. You may have PSM classes also, but that is not a subject of first year, so don't worry about that. I hope you have understood the overall curriculum. You will of course be taught about this curriculum in detail when you go to college also. That was very frequently asked to us in the starting days in the orientation is, why do you want to become a doctor? So prepare a good answer for that if you want to impress the teachers. That's all for this video. We'll see you soon in my next video. Till then, keep learning.
Tell me it's